One way I show up for patients is to double check on them throughout the day, not just during our morning round. So I go back later before I leave, check in, make sure they're doing okay, be another smiling face, and take care of the human side of things as well.
I like to show up for patients by taking the time to answer any questions they have and to speak with them and their family. Frequently, as patients and even as medical trainees, we are confronted with a lot of information, much of which is not familiar. Taking the time to explain that to the patients and to answer any questions they might have or family members is one of the ways I like to show up for my patients.
I show up for patients by working at the UNLV Community Clinic at the Volunteers in Medicine of Southern Nevada. I work there most Tuesday evenings and I work front desk. In the past year and a half, my Spanish has been improving and I've been practicing. And the recurring patients, they've been noticing that my Spanish has been improving and I can see their genuine happiness that I'm able to connect with them so much better now. And I think those little things where you can just kind of even converse or just make sure that these patients know that you are there for them and this is a space for them is so nice for them.
One of the ways that I show up for patients is by reminding myself there's so much to patient care outside of their diagnosis or a pathology. Being there for a patient by showing empathy, compassion, connecting with the patient on a human level is what makes, a compassionate provider to me.
I like to show up for patients by being there to listen to their stories, get a whole picture of what's going on, what brings them in, and everything that led up to that moment. I'm going into pediatrics, so some specific ways that I like to show up for my patients are to be ready to comfort them with a little toy, a cute pen for the little kiddos who might be a little scared during an exam, or to have the current music, books, whatever is on trendy, to give some moments of connection for my teenage patients before we get into the stuff that can make them really nervous during a visit.
The way that I show up for patients is just meeting them where they are. So I'm from a rural area in northern Nevada, and I come from a family that doesn't have a very strong medical background. And so I come across a lot of patients that don't have a ton of medical literacy. And so the way that I show up is just meeting them where they're at, kind of with their educational level, where they're from, kind of their cultural background, and just trying to find ways to connect with them and ways to get them where they need to be.